Good. I'm here, okay?
All right. All right, bro. Thank you. All right, Byron, go for it. Byron. Good evening. Good evening. My name is Delegate Mark Freeland, member of 24th Nomination Council. I represent 8 chapters out of Eastern Navajo Agency, Crownpoint, Nahadishkish, Tehe'ahe, Vicente, White Rock, Lake Valley, Herfano, and Nayeze. Wanted to welcome you all this evening. We want to provide an update for a couple of our service units, Crownpoint Service Unit, as well as the Ditley Health Center, which falls under the Crownpoint Service Unit as well, related to COVID-19. We did have a town hall last week, and we wanted to just do a follow-up and provide you additional information from our federal partners here with Indian Health Service. With me, I have one of my colleagues. You want to introduce yourself, Honorable Yazi? Go right ahead.
All right, Mr. Freeland, thank you. And thank you for setting up the call, okay? I know it's valuable and very important info, and know this COVID is just really taking a hard impact on us, but we'll just continue to be strong. My name is Edmund Yazi, everyone, and I represent 6 chapters, which is the Rue, Smith Lake, Mariano Lake, Pinedale, Church Rock, and the Yamato. And just want to just say that I am here, sir, and I'll leave it at that, Mr. Freeland.
Thank you, Honorable Yazi. Appreciate your participation. Wanted to go ahead and get started and jump right into things and maybe get an update from Kari Wato from the Ditley Healthcare Center. Kari, are you available?
Good evening. Yes, I'm on the call.
Did you want to go ahead and provide your update? Go right ahead.
Yes, I will do that. Good evening, and thank you for the opportunity to give an update. My name is Commander Kari Wato. I just want to say thank you for everything and letting us give this update to the community. I'm currently the acting HSA for Ditley Health Center. Currently, we are continuing our limited services for COVID testing, urgent medical, dental, optometry, lab, and radiology services. We did put a message out on the Northern Navajo Medical Center Facebook page, and we also have a flyer that we are giving out to the community. We are continuing to follow patients in the community through our public health nursing department. We are also assisting Northern Navajo Medical Center with staff due to the surge of COVID patients in Shiprock. We are also coordinating with Northern Navajo Medical Center on our vaccine plan to ensure that the staff that work at DZ get vaccinated. Today, we also had United States Public Health Service officers, behavioral health officers at DZ today, and they were providing mental health support to the staff. Our current 7-day positivity rate is at 21%. So those are the main highlights for DZ, and we're continuing to provide services, and we want to just do our best to ensure that patients have the services that they need, and we hope that everyone continues to stay safe and social distance and continue to wear a mask so we can help fight this COVID. Thank you.
Thank you, Commander. Appreciate that update. Or do you have anyone else from your team on the call?
I don't have anybody else on the call.
Okay.
Hi, this is Vanessa Comer. I'm from Shiprock Service Unit. I'm the CEO of Shiprock Service Unit.
Okay.
So I'm on the call also.
Thank you. Is there anything you wanted to add this evening?
Yeah, maybe just a little bit on NNMC. We are busy. We are doing our outdoor operations, which includes COVID testing out in the parking lot. And we also have our drive-up pharmacy that is still happening. And even though it is so cold this week, our staff are just, they're troopers. They're out there still providing care. So we're doing that. We're also doing some of the, well, our vaccines arrived this morning. So that was, everybody was so happy. Yes, exactly. Yep. So we have our frontline staff that were getting vaccinated this afternoon. So we were getting them vaccinated. So we got that started. So in the meantime, we do have our beds that are near capacity. We usually have try to keep 1 or 2 open so that we can have that. But we're still we're able to transfer out of state, mostly Colorado. So we've been able to find beds for our patients there. We're holding up, and we do have plans for emergency expansion. So we'll be initiating that when the need arrives. In the meantime, also, our PHNs are following cases by phone. They're for those patients that are being monitored at home. These are patients that are called every day by our PHNs, even on weekends. We are following about well over 300 cases at this time. So we have been working nonstop to do that. And that really does help to keep people at home so that we don't have them in the hospital. But with the daily monitoring, if they need to come in for following for a higher level of care, they will be asked to come in. So that has been working very well. And we have about 18% positivity rate for the Shiprock service unit. And let's see, what else can I tell you? So that's what we've been doing. That's a brief update. Thank you. And I didn't introduce myself. I'm so sorry. My name is Vanessa Comer. Thank you. Thank you for providing this time for us to give an update.
Thank you, ladies. Commander and Vanessa, appreciate your continued hard work and diligence. Is there if there was something you wanted to say, a message of some sort, what would it be, ladies, to our people?
This is Vanessa. I would say that we just need to keep wearing our masks, keeping our distance, making sure we're washing our hands. That is what's in our arsenal right now. We just need to stay vigilant. We really need to stay vigilant. And really today was a day of hope. The vaccine has arrived, and I think a lot of people were just relieved that now there's going to be there is hope to get rid of this vaccine, or not the vaccine, but the virus.
Commander?
I'd just like to say to the community, like our CEO said, continue to stay vigilant and to stay home and to stay safe so we can be with our families once again and spend that time with them, and when things are better, and we can enjoy those celebrations once again. So I just want to say, stay safe, wear your mask, social distance, try to stay home as much as possible. Don't send families to the store to do shopping. Maybe just send 1 or 2 people. And just continue to also monitor yourself, take care of yourself, take care of one another. That's it. Thank you.
You're muted.
I'm sorry, I was talking away. I was all muted. I wanted to welcome Roselyn, Navajo Area Director from Navajo Area IHS Regional Director, as well as Melinda Arvizo Siaco from the Speaker's Office. And then we also have 8534. I don't know whose number that is.
It's me,
Who's me?
Herfono.
Oh, hey, Ben. Okay, thank you for joining us. Okay, we are
Yes.
we are on Facebook Live, so let's go ahead and make sure we're on mute, okay? Thank you very much. Roselyn, did you want to go ahead and provide an update? We just heard from Zitlan Tithli Healthcare Center and Northern Navajo. Then we'll wrap up with Crownpoint.
Great. Thank you. Good evening. Again, Delegate Freeland. This is Roselyn, so the area director. It's been a very, very busy 2 days, exciting and emotionally driven 2 days. Yesterday morning, we had the first vaccine that was delivered to Gallup Indian Medical Center for the Navajo Nation. And then we had another distribution that came out today that I know that Vanessa already talked about. So, you know, it seems like a long time ago that started, but it really has been an emotionally driven day. I was out with the staff in Chinle today and as the vaccine arrived, which was a little bit late. But, you know, when I was at Gallup yesterday, there was a lady, a patient that was picking up some medication, and she saw all of the activity moving around, and she was just in tears and just as a patient, very glad that Navajo Nation was getting, that had received this vaccine. I think one of the, so as today, all of the locations on the Navajo Nation, except for Utah Navajo 638 program, all of the locations have received their vaccine. I know that just a little bit, probably like a couple hours ago, the last distribution had arrived at Tuba City. So we are very pleased to be part of the distribution and also ensuring that that the Navajo Nation received its distribution the same time as all of the major hospitals in the big cities. And so so that's a good thing for us. And I know that I saw photos of some of our frontline staff already getting their vaccines both today and yesterday. That has started. So it is the beginning of what we hope will be the next and final chapter for COVID-19. We know that our people have suffered greatly and continue to suffer greatly. So it's hard to sort of understand that there is a silver lining or hope that's coming with this vaccine, but we also have to remember the lives that were lost as a result of this. We have to remember the hearts that have been broken as a result of COVID-19, and with that, I think we're asking that we all of the community members on the Navajo reservation, our families and our friends continue to wear their masks, continue to social distance, and continue to wash their hands, because we still have a long ways to go. We still have a long ways to go. We know that the first part of the vaccine is here. We also know that we will get the second shipment in next week from Moderna. So we're pretty excited about that. This is amazing for us to be where we are at in a relatively short period of time when you think about how what the process is to clear for vaccines and so forth. So again, I have to also send you know, to our first responders, whether they're people that work on the front line for the Navajo Nation, or whether they are Indian Health Service staff or tribal health staff. You know, this is a commendable effort on behalf of the Navajo Nation and the Navajo people. And with that, also the support from the tribal council, the president's office. You know, there's been some bumps and bruises along the way, but we are where we are today because of the collaboration and the partnerships that have been enhanced and strengthened through this process. So I want to again send a shout out to all of the Navajo area team members. The other thing that I wanted to share is that we are still working hard to make sure that we have sufficient space for beds in those events that we need to transfer patients. So we have crafted agreements with the VA out of New Mexico and the VA out of Phoenix and out of Tucson to make sure that we can still transfer patients in the event that we need to do that. We are continuing to do that also on the Colorado side and the Utah side to get those agreements in place. So we don't get, as of right now, New Mexico is still hard to get into in terms of finding a bed for some of our people. So we have to look at all of these other options. The final thing that I would say is the reason I was in Chinle today was we were welcoming a team from Department of Defense. I think this is the first of its kind on the Navajo reservation, where we have 24 providers that will be on the ground by the end of this week. These are critical care teams. These are emergency room teams and ICU teams that will be here to help us meet the critical needs that we're continue to see in our hospitals. We'll also have that same team on the ground at Shiprock. So we're continuing to try to make sure that we're resourced up and that we're finding and having all of the available staff that is needed for our Navajo area IHS, and so as well as all of the Navajo area. So I think we've done a great job up until now. There's still a lot more to do, but I also wanted to share with the community that specifically in the Crownpoint area, we have a new chief executive officer. I don't think he was able to join us for this call, but we will invite him for the next call or whatever we can do to make sure that he is meeting all of the tribal representatives at the local level. He comes to us originally from Oklahoma. His name is Daniel Cox. And so he was here, I believe last Wednesday was his first day. So it's pretty exciting that we are able to fill these critical leadership positions. And I still have one more that I'm hoping to fill here before the end of the year. So Delegate Freeland, thank you again for all of your support. And I know that there's been some very exciting work that's going on at Crownpoint. I'm so proud of that team out there. And I'll turn it back to you, sir. Thank you.
Thank you. Thank you, Director So. Thank you to you and your team, your providers, Dr. Slaughter, all the crew at Crownpoint, nurses, doctors, security, housekeeping, you name it. Those individuals we have a lot to be thankful for and are very appreciative, as well as the crews down at Theru and Pueblo Pintado as well. Honorable Yazi, did you want to say anything?
No, Mr. Freeland. Well, yeah, just a few words, Ms. So, and to the staff again. Ms. So, thank you. And I know these are some trying times, and we just continue to be strong. Just wanted also to note that we are working hard as a team to get the new IHS hospital going too, with Ms. So and within the Eastern delegates as well, with their support and the president. So that's something that we're working hard, and hopefully next year will be a better and good year, and that will, kick in too, as well as for funding. But it's a teamwork effort, listeners. I mean, between the delegates and then the president, vice, and especially the staff with IHS. So, and we'll continue to move that forward too as well. Mr. Freeland?
Thank you, Honorable Yazi. Ms. So, how many doses did Navajo area get in total?
So for the shipment that came in from Pfizer, there was 3,900 that came in. All of Indian Health Service received just a little bit more than 22,000. So that was our portion of, again, the first round. They were all delivered today, and it's quite an operation yesterday, we have been hearing on the news that these have to be in a very cold environment. And so just even transfer, once you open the container, you have only 3 minutes by which to do what you need to do and get those trays separated. And then that I was able to see that. And it's really sort of amazing to see what we have been able to do. And then that first distribution went on to Crownpoint, and as the trays, some trays also stayed in Gallup, and then some trays went on to TMC yesterday. So it was quite an operation for 2 days, where now we have everything. The next shipment that we're looking at for Moderna, and Dr. Slaughter can talk about this a little bit more, is that it doesn't have quite this kind of these kinds of requirements for storage and so forth. So that might be a little bit easier for us. So this distribution for this first for the vaccine that we received from Pfizer had to be carefully orchestrated, and I think our team did an outstanding job to make sure that everything arrived on time today. So yesterday and today. So thank you.
Thank you, Director So, and again, thank you to you and your team. I see Captain Johnson on the line as well. Thank you, Captain Johnson. Dr. Slaughter, good evening.
Good evening.
Good evening.
We're expecting to get 600 doses next week, and we don't have to use those up in 5 days. And those can stay in freezers that we have. So we're looking forward to that.
Okay. Did you or anyone else want to give the update for Crownpoint service unit? Or who could give that?
I think it would be me giving the update.
Thank you. Go right ahead.
So we just looked at our numbers for November, and we tested 4,000 people in November. Prior to that, July had been our high month with 2,900 tests, and that includes Pintado and through. Our current 7-day positivity rate is 21%, but our absolute numbers are going down. We have had 85 positives in the last 7 days. We had 2 of the last 3 weeks, we had 142 cases come back positive per week. So I am hopeful this is a sign of us starting to blunt the curve. It seems like overall New Mexico's bed situation is better for hospitals. They had peaked out at like 980 patients admitted in the state with COVID. And today's number is 860, and we've been able to get patients out to beds that need a higher level of care, which is part of the Department of Health and UNM have both opened up alternate care facilities in Albuquerque, and then Miso and area have helped set up sites in Chinle and other places, and it seems to have taken a lot of the pressure off the beds where we were having patients have to wait in the emergency room for 24 hours to get transferred out. So we still seem to be able to meet the demand for testing. And we are continuing limited services. Those services that we think it would be harmful to postpone are the ones we're doing in person. Children under 2 that need vaccination, prenatal visits, follow-up of abnormal pap smears, hospital follow-ups, those kinds of things. Otherwise, we are trying to do a lot of telephone visits. So we're seeing some patients out at the curb. So my goal is to keep my workforce healthy so I can keep all 3 clinics open. So we have had a really good acceptance for the vaccine from our employees. That's really turned around in the last few weeks. The initial skepticism, we're seeing a lot more acceptance, and I think we've already given 200 doses by today of our 300. Our first tier 1A is anybody that works at the hospital. At one point when we had our 12 patients on inpatient, our dietary staff, we lost half our dietary staff to quarantine and isolation. And we're like, we're going to be the first hospital to close because we can't feed our patients. It just shows people you don't think are essential workers are essential workers. I need my people here in finance to order our supplies and pay the bills and keep, so we don't run out of oxygen. So we are one big team here. We're hoping to do the community health representatives and the Navajo Nation EMS also with this tier of vaccine. And then police, corrections, firefighters are the first priority for next week. So Coyote Canyon has a facility here in Crownpoint for a long-term placement facility, long-term living facility, and we're doing their eight clients and 10 staff also in our group 1A for our high priority vaccine staff. Any other questions?
Thank you, Dr. Slaughter. Honorable Yazzie, do you have any questions, brother?
No questions, Mr. Freeland.
Are you going to take the vaccine when it becomes available, Honorable Yazzie?
You bet. Right away.
We're gonna.
I wish I was.
You wish you were in the first group?
I wish I was still a police officer. But yes, I'll be waiting in line.
Awesome. Thank you. Dr. Slaughter.
Yes, sir.
Would you consider 21% a high number? I know Shiprock or just not Ditley said 21% as well, and Shiprock or Northern Navajo mentioned 18% positivity rate. Would you consider that a high number? And would you also consider that we're maybe at the top of that peak right now, and slowly we're possibly
we're starting to, yeah. I hope we're right about here.
We're like this. We're at that
Yeah.
top pinnacle, and we're
in September we had gotten as low as 2 to 3% of our tests being positive. And
okay.
in September, the difference was the people who were positive, we expected to be positive. They had known household contacts or close contacts. What we're at now is we have people who are positive that we don't know exactly where it came from, which is the definition of community spread. And this whole, so yes, so for our phased reopening, anything over 10% is considered very high. And that the risk of going out, but where I got scared was the weekend after Thanksgiving when the hospital beds were filling up in Arizona and New Mexico and Colorado, Southern Colorado. And at that point is when I put us back into phase 0, where I wouldn't let patients call and say they want an appointment. I made the provider say the risk was worth it. I think coming to the hospital is safe because everybody here has a mask on. And we provide masks for the patients. But in the interest of saving PPE and decreasing anything we could do to decrease spread, I wanted to back off on patients coming to the hospital because I don't want to get to the point where I have 1 hospital bed and 5 patients that need a hospital bed. And how do we decide who gets that hospital bed? None of us want to get there. And the state of New Mexico and area, they really responded quickly to that. And all of our facilities have been able to get patients out. So it's that balance between, this thing's gonna go on a year. Is it worth not coming in to see your doctor for a year versus you need to get your blood work and come in and get out and whether you need to stay home. So we're trying to individualize that by provider, looking at each patient, taking on a patient by case basis and say, we'd really rather do a telephone visit because you're 65 and you have diabetes, and I don't want you to come to the hospital and get exposed if you don't have to. It's been a little hard on everybody because we're all tired of doing this for so long. My traditional healer was talking to me before this and saying he wished he could get a platform for a Zoom meeting for patients. And we struggled with a little bit of how we can do that in social distance. And I think we're going to start with maybe getting him on the radio. He's been taking a lot of our calls from our EPI team for the Navajo only speaking, and I think it's worked out good for the patients and for him. He feels like he's found his niche and how he can help us with this, where he's helping people. Because when you speak a different language and you're not medically trained, COVID's very scary. And I think he's he's been able to connect and explain. He's been using the very nice diagram that Dr. Jim presented last week on how this is spreading. You're exposed, you get tested 3 days later, you're negative, you think you're safe, and you go out and visit people and shop and expose other people, and then you start feeling bad, and then you get retested and you're positive. So he was talking with me about strategies that visual learning works better with Navajos maybe than some of our written learning. And we were maybe going to put some of those make those into poster size and put them by our ED where we're testing and at the other clinics where we're testing, to kind of let people know that one negative test doesn't mean you're not contagious. So to try and this is not just happening on Navajo, it's explaining the surge in the entire United States. It's almost like the increase of ability to test has given people a false sense of security when they get that test too early. So that's why this thing is so hard to stop, because you can be contagious and have no symptoms. So I'm very excited about the vaccine.
Okay, thank you, Dr. Slaughter. I think we can't express enough appreciation and gratitude for Crownpoint Service Unit as well. You and your team, your docs, your nurses, everyone, the personnel, the staff. You even mentioned dietary. I was there last week. Just before you walk in the main entrance, you have to have a temperature check. But we definitely appreciate it and appreciate all that you have done at Crownpoint Service Unit, and continue to do. And I think what you said is it sounded like there was a sense of relief from you when you mentioned that you were happy that the vaccine is here.
Oh, yes.
And I think you're a big part of this, and you as a physician and you as other frontline workers, I think I could never understand or ever explain how exhausted other personnel must be and how relieved they are right now. This is the beginning, hopefully, to the end, of that. And I was telling my chapters this week, we are starting to see that light at the end of that tunnel.
Yes.
And we need to continue to hold our defenses up. Until then,
yes.
That means continue to practice mitigation, social distancing, wearing our masks, washing our hands, doing the things we've been doing for the last 9 months. We're almost there. If we can continue to do that, we'll reach that finish line. And I really am, I'm thankful. I think we all are. But for what you all do, you guys are amazing, and I think all of us appreciate you as personnel and saving lives, and the critical care that you provided, the ambulatory care everything that you all did. So thank you very much.
You're welcome.
From us, the community, the chapters, we thank you so much to Crownpoint Service Unit, Northern Navajo, Titlan Healthcare Center. You guys are heroes. You guys are. Honorable Yazi, did you want to mention anything?
No, well, yeah, just again, Mr. Freeland, you already mentioned with all the IHS workers, and, I have sisters working there in Crownpoint, and, when they got their shot today, they text me and, they were, pretty much relieved. And I know we lost a lot of our loved ones. I lost my mom, 3 weeks ago, and it is an impact, but yet, they're in a much better place than we are in right now. But my heart, goes out to all the medical care people that are out there working the front lines. And all we can do on our side, and, with our, is just pray and pray that this number will go down. And it has caused a lot of stress among us, the elders, and even to our young kids. And so we just need to hang tight and be strong, and much grateful to our medical personnel, and just keep up the good work. And we'll continue in our prayers for strength and for protection, and to our police officers, all the frontline workers out there, Mr. Freeland. Okay, sir?
Thank you, Honorable Yazi. Totally agree with you, brother. We can't thank them enough. Dr. Slaughter, is there a message you want to convey tonight, between now and next week, possibly? Did you want to say something to the listeners and say, you know what, mask up, or?
Yep. Hang
whatever.
in there with the social distancing and limiting visiting. Christmas is coming, and I know everybody's used to celebrating at Christmas with their friends and family, but we can just buckle down for another month or two and get this vaccine out. And I really look forward to offering it to our patients. I believe our plan here is to offer it to 65 and over with high-risk conditions. We're also letting individual providers make referrals for patients they have that they consider high risk. We are fine-tuning our distribution, and we will be using forums like this to let people know who can get the vaccine. I'm just hang in there a little longer.
Awesome. Thank you very much, Dr. Slaughter. We'll continue to have these updates every Tuesday, okay? And week to week. I really appreciate you all providing updates to our area and Eastern Agency. It's very important that we get the message out to constituents and to our people. Exactly what you said. Don't visit. Don't you continue to social distance. I think those are very, very important messages. I don't know if you. I had another question for you, real quick, Dr. Slaughter. After the Thanksgiving holiday, did you see a surge, or did you see any sort of spikes?
It's like we spiked right around Thanksgiving.
Yeah.
Right soon thereafter. And it seems like New Mexico did too. We are, not to jinx us, but I think we're far enough out now, because it should have been 2 weeks after Thanksgiving. And like I said, our last week numbers are a little lower than our previous 4 or 5 weeks.
Ending that curve.
We need to see another. I mean, the epidemiologists measure this in 14 days rolling averages a little bit, but
okay.
Not as bad as we had feared. It does not look.
Good. So hopefully our people took that message and really applied to it, and not visited their family during Thanksgiving, which is great to hear. I hope that's the case. But we'll know more maybe next week. But thank you for that. We definitely appreciate it, Dr. Slaughter. Again, next week, again, we'll ask for another update if ladies don't mind.
Okay.
Docs and team, next Tuesday at 5 p.m. we'll be back on live. Roselyn, anything closing? You have Captain Johnson too.
Yes, good evening again, everyone. So I guess my closing words would be, it is truly a historic time that we're all sort of walking through right now, but it's also bittersweet in terms of the people that we have lost. And so when we get to that point that each of us, hopefully each of us will get that vaccine, we have to think about our families and our friends and our relatives that are not here to partake in that and perhaps could have been here a little bit longer with us. So it has been truly an emotional few days trying to wrap my mind around everything that we have gone through, and yet to be at this place where, as I've been saying for the last 2 days, it's the beginning of the next part of our lives with COVID, and hopefully the end of COVID. But and just to remind everyone, I think that we don't want to relax at this point just because we have the COVID vaccine. We have to stay vigilant, and we have to get ourselves to this next level and through the vaccine. And so I commend, all of the staff. I commend all of our patients. I know it's been a long few months to have to keep listening to us and keep doing what we've been asking you to do. And I sincerely appreciate that. And I think of all the people on the Navajo reservation all the time, and the challenges that we face and will continue to face. But I also see the good part of who we are and what this has brought out in us. So thank you again, Delegate Freeland, and thank you to the tribal leaders for your support.
Thank you. Honorable Yazi, any closing words?
Just that, like I said, with prayers, everyone. And then again, yes, the medicine is here, but that doesn't mean we let our guard down. Let's continue to abide by the health orders and just keep at it until we get the numbers way lower, and then even this COVID away from us. And so that's all I have, and be safe, keep strong in your prayers, and we'll continue to get through this. Mr. Freeland?
Thank you, Honorable Yazi. To all of our people out there, all of our people in Eastern Navajo Agency, please continue to mitigate, keep your defenses up. Please social distance, please wear a mask. You heard it here tonight. Please continue not to visit family members. Please, it's real important that we finish strong, and we're doing a good job. And the healthcare workers seemed relieved tonight. And that's a very important message I think we need to remember, is we did a good job for Thanksgiving. I hope we did, but let's continue that on that path. We can do it. We can do it. So with that, I want to say thank you very much. God bless you. Stay safe, and we'll talk next Tuesday at 5 p.m. Again, we'll have another update for Eastern Navajo. Thank you very much.
Thank you.
Thank you, everyone.
Thank you, sir.
Nope.